Coronary heart disease refers to the process where the blood vessels supplying the heart, the coronary arteries, become clogged up with fatty deposits over time. This can be what we call stable coronary disease, which occurs over years and decades and can result in symptoms such as exertional chest pain or breathlessness. In an acute heart attack, what happens is you get a tiny, innocent-looking plaque that suddenly ruptures. So where 20–30% narrowing becomes a complete blockage, because actually what happens is a blood clot accumulates at that site and completely blocks the vessel. Coronary heart disease can be asymptomatic. You can have no symptoms because you have to get to a point where you have a narrowing of 60–70% before you start noticing a reduction in blood supply to the heart muscle. Typically in people who have that level of narrowing, they get symptoms when they exert themselves, and the classic symptom is angina, and by that I mean you get chest pain every time you exert yourself, which disappears or abates quickly when you rest. In patients who have an acute coronary syndrome, in patients who have a heart attack, those symptoms are of a central crushing chest pain at rest, not on exertion, at rest, typically associated with a sensation of nausea, sweating, and that pain spreading to other parts of your body, such as your left arm and jaw. Coronary heart disease can be diagnosed, thankfully, with non-invasive tests nowadays. And the key test to diagnose coronary heart disease is a CT coronary angiogram. A CT coronary angiogram involves injection of a dye through a cannula in your vein. That dye shows us whether the blood vessels have any narrowings in them and whether those narrowings are severe enough to cause symptoms such as exertional chest pain. You can definitely prevent coronary heart disease by employing a strategy where you look after yourself in terms of lifestyle, and that involves not smoking, eating well, keeping your weight at a healthy level, and tracking markers such as your cholesterol, ensuring that you've not become diabetic. Critically for me, another important step in preventing coronary heart disease is a regular and strenuous exercise routine. Coronary heart disease can definitely be treated, and it can be reversed in the sense that you can have a 99% blockage that we can treat with a procedure called a coronary angioplasty, where we put a balloon to stretch the artery open, and then a cylindrical metal scaffolding that keeps that vessel open, something called a coronary stent. So you can have a scenario where you've gone from a 99% narrowing all the way back to 0%. And the way of ensuring that that narrowing doesn't recur is by putting you on appropriate medications and critically coming up with a tailored plan for you that tells you how you should modify your lifestyle, including your nutrition and levels of exercise. Very occasionally, if there are multiple blockages that are severe, we may actually decide that the best treatment for you is open heart surgery, which has been shown in those particular scenarios where you have lots of coronary narrowings in lots of areas, that's a better treatment for you.